Dr. Singer's phenomenal. I mean, he's got a great bedside manner, always makes me laugh, you know, even if I'm not feeling good.
Janice is a remarkably brave woman. She came to meet me. She had just had her surgery. I was immediately struck by her age. She was relatively young. She had young kids at home. My first order of business actually was she was actually having difficult to control seizures.
Today, Janice is visiting Dr. Samuel Singer, a neuro-oncologist at the John Theuer Cancer Center in Hackensack, New Jersey. She recalls the night her brain went haywire and her life changed dramatically.
My face just started twitching like this, and I went into the bathroom to see, and it was just doing it itself. And then I tried to talk and nothing would come out. And then I just went into grand mal seizures. So that was it.
Soon after, Janice was rushed into surgery. It was then she discovered an aggressive brain tumor was causing her seizures.
I found out I have glioblastoma on August 9th, 2014.
Glioblastoma is what's called a primary malignant tumor of the brain. It doesn't come from other parts of the body, and it primarily stays in the brain. It causes problems to people by affecting the parts of the brain where it's growing. It's a very aggressive cancer. It's very difficult to treat. So look over here at my nose and tell me how many fingers you see.
1.
It's not as common as you might think. It's not even in the top 10 of cancers that occur in either gender in terms of incidence. But I think it has a certain, it captures people's imagination or terror in a certain way, more so than other cancers. I think by virtue of the fact that it's in the brain and that it affects who we are and the things that make us human.
The diagnosis of brain cancer is also feared because the cancer cells grow in one of the most vulnerable parts of the body, an organ that encapsulates the essence of who we are. Dr. Singer works as a team with fellow neuro-oncologist Dr. Samuel Goldlust and brain surgeon Dr. George Captain. Together, through their individual expertise, they help patients through the most difficult journey of their lives.
The general journey of treatment begins with the patient suffers from symptom that lead to the diagnosis. The symptom can be headache, it could be a seizure, which is an electrical short-circuiting of the brain. It could be difficulty with language or difficulty with movement or a funny sensation. That compels the patient's physician to obtain imaging or an MRI or CAT scan which shows the abnormality, and then they're referred to a neurosurgeon.
In cancer in general, there's 3 types of treatments that are sort of broad categories of types of therapy. Surgery being number 1, radiation therapy, and chemotherapy. Each of those circumstances in glioblastoma has a reason why it's difficult to use in this disease. So surgery, you're operating upon the brain, which has a very intricate function, and parts of the brain can't be removed because they're integral for things like breathing and talking and moving. And even if a tumor infiltrates or invades those areas, you can't safely remove them and leave the person the same before and after surgery. So there are many cases where a tumor can't be removed completely.
Because of the elusive characteristics of the glioblastoma tumor, paired with its tenuous location, even if surgery is successful in removing most of the cancer, its aggressive tendencies can often cause what's left of the cancerous cells to spread like wildfire. For these reasons, the average life expectancy of someone suffering from glioblastoma is only 15 months.
So I think compassion plays a big part in that, in understanding what your limitations are, understanding the balance between science and medicine.
No one understands this compassionate sentiment more than the Vandemark family and their daughter, Caroline.
Oh, Caroline had a great personality, full of fun, full of life, witty, someone everyone wanted to be around. strong, beautiful, just a powerhouse.
Just loved being around her friends and having a good time. She just liked people and liked being alive.
She was really courageous. I mean, I don't think she ever really felt sorry for herself, and so even through her last days, she was really, really courageous.
When Caroline started experiencing debilitating headaches, her mother, Mary, immediately rushed her daughter to the emergency room.
I remember I was at work and Mary called me and said that Caroline was in the hospital and she had a mass on her brain.
After surgery, it was discovered Caroline suffered from glioblastoma, a medical term that was completely foreign to Mary.
I had no idea. I couldn't even pronounce the word. I had no idea. But I did Google it. It said that 5% survival rate. But I didn't believe it. I said, no, Caroline can handle this.
She was in college when we met her, and we don't often meet a lot of patients with glioblastoma in college. Not the most usual time frame for the disease, which oftentimes happens to infants or people in their 50s, 60s, and 70s.
So the next step, Caroline had her first surgery.
Rounds of radiation followed. After that, chemotherapy, standard treatment for glioblastoma patients. After almost a year of being diagnosed, however, Caroline's brain cancer cells started growing. Doctors Captain and Goldlust were trying to help her achieve personal milestones through continued treatment while keeping her comfortable.
She's going out with friends, she's shopping with her sister, she has a little headache every now and then, but it depends on severity if we will do Tylenol or we will do the big guns like, what were we doing? I can't even remember, steroids. But she was living life.
I think we gave her a lot of time. She graduated from college. She was able to attend a wedding that she had wanted to go to.
So she goes to her friend's bachelorette party in May, and she's very sick. And then, I guess from May, then she would get terrible headaches and we would go back to the emergency room. It seemed like once a week. I got scared and Dr. Gola said, bring her in. And then that was it, she never came back home.
So Janice, I'm going to show you some of your scans and how they've changed over time.
Okay.
Janice has been looking forward to this day. Recent scans show her tumor to be stable. There's no recent growth. Her treatment of chemotherapy, combined with a vaccine trial, seem to be working.
She's neurologically intact. She really has no symptoms right now related to her tumor, which is a great thing. I keep telling her my goal is to keep her in this state for as long as possible, indefinitely if we can, but we'll take it scan by scan.
I would say just, keep confident. We don't know when we're gonna be here, so just enjoy life.
My life before the diagnosis was pretty simple. We have two kids, 1 3, 1 7. I was running this marina, and life just kind of, two little kids, that was sort of the center of our lives. And just raising them, getting them off to school, putting them in camps. Typical, I think, kind of typical family life.
A little over a year ago, Mark Nelson started suffering from a tingling on his left-hand side, combined with episodes of hard-to-explain auditory sensations. This phenomenon was occurring because a brain tumor was nesting on the auditory center of Mark's right temporal lobe.
What the brain does is amazing, and what it can do, what it does all the time is amazing. And when it's not quite working right, it's really illustrated how how many things it's doing so well most of the time.
Mark quickly underwent surgery, with doctors working diligently to get as much of the tumor as possible.
They got about 80% of the tumor out. 20% of the tumor was sort of wrapped around a blood vessel, so they had to leave that.
To address the remaining tumor, Mark committed to the standard rounds of radiation and chemotherapy. But he also decided to undergo a new treatment that neuro-oncologist Dr. Machi Mergola at the University of Washington Medical Center was using on his glioblastoma patients.
In general, the smaller the cell, the higher the frequency needs to be. So for glioblastoma, the device produces the specific frequency of the electrical field that is sort of constant for this particular indication. Once the device is switched on, it basically works continuously, producing the same frequency of the electrical field over time.
The only real side effect is my skin needs a break from it. You know, if you think about how you're having tape on your head for 20 hours a day, there's a little irritation, but it's manageable.
The patients who are using tumor treating field therapy are monitored similarly to patients who are receiving chemotherapy. We typically see our patients on a monthly basis for checkups, and we typically obtain brain scans every 2 to 3 months to see how effective therapy is.
Today, with his wife Christina, not only is Mark going in for a monthly checkup, he is also undergoing a scan that will reveal if the tumor treating arrays technology is having a positive effect.
Maybe I'm a little crazy, but I look forward to the MRI. I look forward to meeting with Dr. Mergola. I don't know what I'm going to find out. We don't know. But it just kind of, as we say a lot, it is what it is.
The survival in glioblastoma is unfortunately very short. With the best treatments available, the median survival is anywhere between 12 and 15 months, and this is with aggressive treatment.
A patient of Dr. Mergola's who is beating those odds is Liz Albertson, a cancer survivor of over 5 years. She is considered a statistical miracle in the medical world of glioblastoma.
I think there's a lot to brain cancer that they don't know. They don't know what causes it, they're not sure how to get rid of it, and they don't know why a small percentage of people like me live longer than the rest of the people.
Unlike many glioblastoma patients, Liz did not undergo brain surgery for the removal of her tumor. Instead, she was given chemotherapy and rounds of radiation, which stalled the tumor, but only temporarily.
It started to grow, and so they did what they call a gamma knife radiation. And what they do is they take a pinpoint measurement in my head from an MRI, and then they make a very precise blast with radiation at that one spot that's growing. And it worked. It stopped growing.
Dr. Mergola says there may also be another reason for Liz's hopeful prognosis. She carries the MGMT gene.
An MGMT gene is responsible for making a protein that helps cancer cells repair themselves after they're damaged with chemotherapy. In some patients, this gene is turned off, and the protein is not being made, and these patients typically do better, they live longer. The gene is inactivated by methylation, so the word we typically use when we describe this to the patient, we say you have a methylated MGMT gene, and this means that you have a better prognosis.
But with success, there are sometimes permanent side effects and symptoms of the disease and the treatments that keep it at bay.
I still have my long-term memory, but my short-term memory is very damaged, and I have to write everything down.
The tumor, again, depending on the location in the brain, can cause disability, can cause weakness, can cause sensory problems. can cause memory difficulties.
Liz, who once practiced law, looks forward to gaining her energy back and reclaiming her life.
I'm stubborn, and if I set my mind to something, I'm going to do it. And my husband and I have been together since high school, and I don't want to leave him. I'm not finished yet. I try to volunteer. I'm looking for a job. I want to get back to my life because I could live a long time more, and that's just the way I feel.
Research for the cure and treatment of glioblastoma is in full force at the lab of the John Theuer Cancer Center. And it is also here where Caroline Vandermark's legacy lives on.
Our charitable foundation, which supports nearly all of our brain tumor research, is named in honor of Carolyn and the Vandermark family. And in that way, her spirit lives on.
So now we raise money for brain and spine cancer research with a 5K that we have in Caldwell, in the town we live in, every September. And we had our first one last year, and we raised almost $50,000.
I figure that, you know, if this brain cancer came and got her, I'm going to go and get it.
She would love this. To all these, she loved people, she loved being around people, you know, the party afterwards in the Cloverleaf, she would be right there, right up front, loving it.
For more information about glioblastoma, please visit these websites: abta.org, abta.org, and chriselliottfund.org.